A closely watched meeting begins at the CDC today, and it could result in a big change when it comes to childhood vaccines. Here's ABC's Andrea Fujii.
This morning, a CDC advisory committee is set to meet to discuss whether to change the recommendation that newborns receive the hepatitis B vaccine at birth, a recommendation in place for decades. Health Secretary Robert Kennedy has questioned its effectiveness.
I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines.
There's no cure for the highly contagious hepatitis B virus. For those infected, it can cause serious liver infection. Some people can recover, but for others, particularly children, hepatitis B can be deadly. Most experts say giving the vaccine at birth prevents infection by an infected mother.
So it serves as a safety net, not only for mother-to-child transmission, but for early accidental household exposure to the hepatitis B virus.
It's estimated that more than 2 million people in the U.S. have hepatitis B, and half don't know they're infected. But one of the CDC committee members has argued unless the mother has hepatitis B, newborns don't need to be vaccinated right away. Other experts disagree.
What I can see from my perspective is there's no new safety data, that there's no necessarily scientific evidence for changing this.
The CDC says infections plummeted after 1991 when the vaccine was recommended for newborns. Now, the committee's decision is also important for insurance reasons because most insurers are required to cover vaccines the CDC committee endorses. Andrea Fujii, ABC News, New York.